Welcome to this deep dive. We've got a collection of sources here, all centered around a common but honestly often confusing finding in pets: splenomegaly.
Right. Which is really just the technical term for an enlarged spleen in dogs and cats.
Exactly. And as these sources really highlight, finding an enlarged spleen is rarely the end of the story.
Mhm.
It's usually just the beginning of figuring out why.
That's the key question, isn't it?
Yeah. So our mission today is to, cut through some of the complexity in this material. We want to give you a clear understanding of what an enlarged spleen actually means for a pet.
And the huge range of things that can cause it. Some not so serious, others, well, extremely serious.
Right, and how vets approach diagnosing the root cause.
Hmm.
We'll pull out the key signs you should watch for, the diagnostic steps, the treatments, all straight from this information we've gathered.
And it's interesting, the sources really emphasize that splenomegaly itself. It isn't usually the disease.
It's a sign. Signal pointing to something else going on.
Exactly.
Yeah.
And that something else could be anything from, temporary changes, even normal ones sometimes, all the way to aggressive cancers.
So understanding this finding is just critical for figuring out the pet's overall health picture.
Oh.
Let's dig in.
Okay. Well, what's immediately clear from looking at all this is just how central the spleen is. It's involved in so many different body functions.
So its response, its enlargement, really tells us something about the pet's internal state.
It can be a real window, yeah.
That makes sense. So before we get into why it gets bigger, maybe we should quickly cover what the spleen is. What's its normal job?
Okay, yeah. So think of the spleen as having like two main areas of responsibility. One's related to blood hematology,
Uh-huh.
and the other's for the immune system.
Okay.
So on the blood side, it's a really important filter. It pulls out old or damaged red blood cells, platelets, cleans things up.
Filtering the blood.
Right. And it's also a major storage site for red blood cells, especially in dogs.
Oh, interesting. Why is that important?
Well, it means the dog's body can essentially give itself a boost of oxygen-carrying cells during excitement or stress, like an internal transfusion almost,
Wow. Okay. A reserve tank.
pretty much. And if the bone marrow is having trouble keeping up with production, the spleen can actually jump back into making blood cells itself. That's called extramedullary hematopoiesis.
So it can pick up the slack from the bone marrow if needed.
It can try, yes. That's the blood side. Then there's the immune function.
Right, the other portfolio.
Yeah, it's packed with immune cells. It's constantly surveying the blood, producing antibodies, filtering out bacteria, viruses, other invaders, basically watching for trouble.
Okay, so filter, reserve tank, and immune surveillance. No wonder so many different things can affect it.
Exactly. It's involved in a lot.
And you mentioned its size can change even normally, especially in dogs.
Yeah, that's a fascinating point in these sources. The dog spleen is, well, pretty dynamic. It can contract and expand quite a bit.
Just normally.
Yeah, things like excitement, stress, even some anesthetic drugs can cause it to temporarily swell up, mostly from blood pooling.
But cats are different.
Cat spleens are generally smaller, thinner, and their size doesn't tend to fluctuate nearly as much, more consistent.
Okay, so splenomegaly just means bigger than normal. And the sources kind of break down how it looks when it's enlarged.
Right. It's usually described in one of two ways. Either diffuse, meaning the whole organ is just uniformly bigger.
Okay, smooth and enlarged all over.
Correct. Or it can be nodular. That means you find distinct bumps or lumps or actual masses within the spleen tissue.
Got it. Uniformly big or lumpy. Now, the core question, how does it actually get bigger? What are the biological mechanisms?
Well, these sources lay out about four main ways this happens. First is inflammation or splenitis.
Okay.
This is the spleen reacting defensively, usually to some kind of infection, bacterial, fungal, viral, that sort of thing.
So it swells up because it's fighting something off. Makes sense. What else?
Another mechanism is called lymphoreticular hyperplasia. This is basically an increase in the spleen's immune cells and its filtering parts.
So like bulking up its defense systems.
Pretty much. It happens when it's being constantly stimulated, maybe by a chronic infection, or if it's working overtime, filtering out abnormal blood cells, like in certain immune diseases.
Okay, so the immune system working harder makes the spleen grow. What's number 3?
Congestion. This is simpler, really. It's just blood backing up because it can't drain out of the spleen properly.
Like a traffic jam for blood.
Exactly. That can happen if the spleen twists on itself, that's splenic torsion, or if blood is backing up from, say, severe right-sided heart failure. or even, as we mentioned, temporarily with certain sedatives.
Ah, so that anesthesia effect is congestion.
Yes, usually. It's blood pooling because the vessels relax or pressures change.
Okay. And the last one.
The fourth main way is infiltration. This is when abnormal cells or substances actually invade and build up in the spleen tissue.
And this is where cancer comes in.
Yes, crucially. Cancer cells infiltrating the spleen is a major cause. But it could also be other things, like abnormal proteins in diseases like amyloidosis, though that's rarer.
Do these different ways it gets bigger tend to look different, like diffuse versus nodular?
Often there's a correlation, yeah. Diffuse enlargement is more common with things that affect the whole body, like congestion, widespread inflammation, or cancers like lymphoma that spread throughout the organ, or EMH,
Right.
whereas nodules usually point to more localized things, bumps or masses. Now, these could be benign.
Like a bruise or just overgrowth?
Right, like hematomas, blood clots, or benign growths called nodular hyperplasia, which are really common in older dogs.
Mm-hmm.
Or they could be malignant tumors, like hemangiosarcoma.
But, and this seems important, how it looks doesn't always tell you for sure.
That's a huge challenge. As we'll definitely discuss more, you often can't tell definitively just by looking at it on an ultrasound, for example.
Right. Okay, so are some pets more likely to get these spleen problems than others? Any breed or size risks?
Well, splenomegaly can happen in any dog or cat, really, but the sources definitely point out some predispositions for specific causes.
Like what?
A classic one is splenic torsion, that twisting we talked about. It's way more common in large breeds with deep chests.
Like German Shepherds, Great Danes.
Exactly. Those breeds where the anatomy just makes it, well, more possible for the spleen to move around and twist.
Makes sense structurally.
Yeah.
Anything else?
Yes. A really big one is hemangiosarcoma. That's a very aggressive spleen cancer. It's much more common in middle-aged, large breed dogs.
Any specific breeds pop up in the sources?
They consistently mention German Shepherds again, Golden Retrievers, and Labrador Retrievers as having a higher risk for hemangiosarcoma.
So finding a splenic issue in one of those breeds definitely raises the concern level for certain things.
It absolutely does. It puts specific possibilities higher on the list.
Yeah.
But, to add a layer of complexity, the sources also mention that just feeling a prominent spleen during an exam might actually be normal for some breeds, like German Shepherds or Scotties.
So even palpating it isn't always a sign of trouble.
Not necessarily, no. It depends on the breed and the context.
Okay, so putting breeds aside for a sec, what might an owner actually notice? What symptoms show up if a pet has splenomegaly?
This is tricky because often the signs are really vague. They usually reflect the underlying disease, not just the big spleen itself.
Sometimes it's found by accident.
Absolutely. Found incidentally during a routine checkup or when doing imaging for some other reason entirely, no obvious signs at all.
But other times it can be really dramatic, right? If something ruptures.
Definitely. Especially with acute problems like a mass bleeding internally or a torsion. Then you might see sudden collapse, severe weakness, just profound lethargy. That's often due to blood loss and shock.
What else?
Their abdomen might look bloated or distended. Sometimes it's subtle, sometimes it's really obvious. Maybe even with a fluid wave, you can see if there's a lot of blood. They could show signs of belly pain, have pale gums because of the anemia, a really fast heart rate, fast breathing, vomiting, not wanting to eat. Those are common in an acute crisis.
And that torsion in deep-chested dogs, any specific signs for that?
Well, besides the belly pain and distension, they often just seem really off lethargic, refusing food, vomiting, and sometimes torsion happens alongside bloat or GDV, which is its own emergency.
Okay, that's the acute stuff. What about slower, more chronic problems causing the spleen to enlarge?
The signs there are usually much less dramatic, more gradual, maybe just general lethargy, less energy than usual, intermittent vomiting or diarrhea that comes and goes, a poor appetite, maybe losing weight slowly.
Anything else?
Sometimes owners might notice the belly seems a bit bigger off and on, or they might even feel a lump if the spleen gets really large. If it's part of a bigger systemic illness, you might see other things, like drinking and urinating more, or signs that just wax and wane over time.
And when the vet examines them, what else might they find besides maybe feeling the spleen itself?
Well, they might or might not be able to feel the spleen or a distinct mass, depends on size and position, but they're definitely looking for those signs of shock in an acute case, the pale gums, weak pulses, fast heart rate.
Checking for stability.
Exactly. They'll check the abdomen carefully for distension, any sign of fluid. They might notice bruising or tiny pinpoint hemorrhages, called petechia, on the skin or gums. That can signal a clotting problem like DIC, which unfortunately often goes along with nasty cancers like hemangiosarcoma.
So looking for bleeding issues.
Right. And they're also looking for other clues. Is the liver also enlarged? Are the lymph nodes swollen? Are there any heart rhythm problems? All these things help build the picture and point towards whether this is just a spleen issue or something more widespread.
Okay, the physical exam gives a lot of context. But gosh, with that huge list of potential causes and signs, how do vets actually start to narrow it down? What's the diagnostic game plan?
It has to be systematic precisely because the list is so long. It always starts with that detailed history from the owner and the thorough physical exam we just talked about. Acute versus chronic, breed, what exactly have you seen at home?
Then presumably lab tests.
Absolutely. Lab work is crucial. A CBC complete blood count is standard.
What are they looking for there?
Lots of things. Anemia is a big one. Is the pet losing blood? Is the body trying to make new red cells? Or is something destroying them? Low platelets thrombocytopenia is another key finding.
Yeah.
Are they being used up in clotting, destroyed by the immune system, or just held up in the enlarged spleen?
Okay.
High white blood cells might point to infection or inflammation. And they look for specific weird cells too, like spherocytes, which suggest immune-mediated red cell destruction, or cystocytes, fragmented red cells, which can be a sign of DIC.
What about other blood tests, like a chemistry panel?
Yep, chemistry panels look at organ function. Liver enzymes might be up if the liver's involved or if cancer has spread there. Bilirubin levels can be high if lots of red cells are breaking down. Lactate can indicate shock or poor tissue perfusion. Globulins, a type of protein, can increase with chronic inflammation or certain cancers.
And clotting tests.
Coagulation panels are vital, especially if there's bleeding or if hemangiosarcoma is suspected, to check for things like DIC. And depending on the case, they'll run specific infectious disease tests for tick-borne diseases, HELA-VF5 in cats, things like that.
So blood work paints a picture of what's happening internally. But to actually look at the spleen, imaging.
Imaging is absolutely essential. X-rays or radiographs can confirm the spleen is enlarged, sometimes give clues about its overall shape, like that C-shape seen with torsion sometimes. They show if other organs are being pushed aside or if there's obvious fluid in the abdomen.
But they don't show the inside structure very well.
Not in detail, no. For that, abdominal ultrasound is really considered the gold standard for looking at the spleen itself.
What does ultrasound show?
It gives a detailed view of the spleen's internal tissue, the parenchyma. Is the enlargement diffuse, or are there distinct masses or nodules? It helps characterize what those look like, their texture, echogenicity. It's great for spotting even small amounts of free fluid in the abdomen and for checking out other organs like the liver.
Okay, now, I want to circle back to this critical point from the sources. Can the ultrasound tell you if a mass is benign or malignant? Cancer or not cancer?
And this is probably one of the most important and frustrating takeaways. Ultrasound cannot reliably tell the difference.
Really? Even with experienced radiologists?
Even then, a benign hematoma, just a blood clot, can look identical to a malignant hemangiosarcoma on an ultrasound image. That's a major limitation we always have to keep in mind.
Wow, that's tough.
It is. Now, Doppler ultrasound can be very helpful to assess blood flow, which is key for diagnosing torsion where the blood supply is cut off.
Okay, so if ultrasound can't give the final answer on a mass, how do you find out what it is?
Often you need to get a sample of the actual tissue. One option is a fine needle aspirate, or FNA.
Sticking a needle in.
Guided by the ultrasound, yes. It can be useful for diagnosing diffuse conditions like lymphoma or mast cell tumors or EMH or just general inflammation or hyperplasia.
But there are downsides.
Yes, significant ones, especially with masses. There's always a risk of causing bleeding, particularly if the mass is very vascular, like a hemangiosarcoma or a hematoma.
Okay, risk of bleeding.
And the sample you get might just be blood, or it might not actually contain the diagnostic cell, so you get a non-diagnostic result. But most importantly, the cells you get from an FNA, the cytology cannot reliably distinguish between a benign hematoma or nodular hyperplasia and a malignant hemangiosarcoma.
So FNA doesn't solve that core problem either.
Not for that specific critical question, no.
So if you have a splenic mass, especially in a dog where hemangiosarcoma is such a big worry, what's the next step, the definitive step?
For splenic masses, especially if you suspect cancer or if the pet is actively bleeding from it, the definitive diagnostic step is often surgery and exploratory laparotomy with splenectomy.
So going in, looking around, and taking the spleen out.
Exactly. It allows the surgeon to visually inspect the entire abdomen for any signs of cancer spread or other problems, and crucially, it provides the entire spleen for analysis.
So the surgery is both diagnosis and treatment in those cases.
It often serves both purposes, yes. Removing the spleen removes the immediate problem, like the bleeding mass or the twisted organ, and then you send the whole thing off for histopathology.
Microscopic examination.
Yes, a pathologist examines slices of the tissue under a microscope. This is absolutely essential. It's the gold standard. It gives you the definitive diagnosis of what that mass or enlargement actually was.
And that dictates everything else, the prognosis, further treatment.
Precisely. You can't make informed decisions without it.
Okay, so treatment obviously hinges entirely on that diagnosis.
Yeah.
What happens first if a pet comes in, crashing, bleeding from the spleen?
Priority 1 is emergency stabilization. That means aggressive IV fluids to combat shock, blood transfusions if they're severely anemic, strong pain medication, maybe oxygen support. The goal is just to get them stable enough to survive and hopefully stable enough for surgery if that's needed.
And splenectomy, removing the spleen, is the go-to for masses and torsion.
Yes. It's the standard treatment for confirmed or highly suspected splenic masses, especially in dogs, because of that high cancer risk. Also necessary for torsion, splenic abscesses, or severe, uncontrollable bleeding from the spleen.
Any other reasons to remove it?
Occasionally, it's done for severe refractory immune-mediated diseases like IMHA or IMT, where the spleen is destroying too many red cells or platelets, and medication isn't working well enough. Removing the factory helps.
And after it's out, you mentioned sending it off.
Absolutely critical. Always submit the removed spleen for histopathology. Cannot stress that enough. That's how you get the real answer.
Makes sense.
And often, especially in those large, deep-chested dogs already undergoing abdominal surgery, vets will perform a prophylactic gastropexy at the same time.
That's tacking the stomach down.
Right, to prevent future GDV or bloat, since those breeds are prone to it, kind of a while we're in their preventative measure.
Okay, what if surgery isn't the main answer? Like, if the splenomegaly is from an infection or an immune disease,
Then it's all about medical management, treating the underlying cause. So, antibiotics for bacterial infections, antifungals if it's fungal, immunosuppressive drugs for those immune-mediated conditions.
chemotherapy.
Chemotherapy if the diagnosis is a cancer like lymphoma, which is often treated systemically rather than just by removing the spleen. Or if it's congestion from heart failure, then cardiac medications are the key.
Is there ever a time when you just watch it monitor an enlarged spleen?
Yes, observation can be an option, but it requires really careful thought and discussion with the owner.
When might that be considered?
Maybe for an incidental finding of just diffuse enlargement, no clinical signs, and imaging suggests something non-aggressive like EMH or mild congestion, or perhaps for very small nodules that look clearly benign on ultrasound, again, in a pet with no symptoms.
But it's not without risk.
Absolutely not. The owner must understand the risks. Primarily, the risk that even a benign-looking mass could potentially rupture and cause life-threatening bleeding down the line. So it's not a do-nothing approach. It's active monitoring, usually with repeat ultrasounds, and knowing what warning signs to look for.
Sounds like a stressful situation for an owner, weighing those options. Speaking of outcomes, what is the prognosis generally?
Oh, it's hugely variable. It completely depends on the final diagnosis from that histopathology.
What are the good scenarios?
Prognosis can be excellent for those temporary physiological changes, or for benign things like hematomas or nodular hyperplasia after they've been successfully removed surgically. Many infections or immune conditions carry a good prognosis if they respond well to the right medical treatment. Even splenic torsion, if caught early and fixed quickly without major complications, can have a good outcome.
And the flip side, when is it bad news?
Generally, if the cause is malignant cancer, the prognosis is guarded to poor. Especially, and we keep coming back to this, for hemangiosarcoma in dogs.
What kind of time frame are we talking about there?
The sources consistently cite pretty grim median survival times for HSA, maybe only 2-3 months with surgery alone, perhaps stretching to 4-6 months, sometimes a bit longer if you add chemotherapy after surgery, but it's usually measured in months, not years.
That's tough.
It is. And the prognosis depends heavily on the exact tumor type, how advanced it is, has it already spread, and whether secondary complications like DIC develop.
This has been incredibly illuminating. It really shows how complex something seemingly simple like an enlarged spleen can be.
It really does. It underscores that the spleen's condition is often just a symptom, a reflection of something bigger happening in the body.
So maybe the key takeaways for you, the listener, are, if your vet finds splenomegaly, understand it's a sign, it needs investigation, don't ignore it.
Absolutely. And crucially, if a mass is found in the spleen, particularly in a dog, remember that stark warning from the sources. There's a significant risk it could be malignant, especially hemangiosarcoma.
That 50-50 kind of rule people mention.
Yeah, roughly the data suggests about half of splenic masses in dogs turn out to be cancer, and about half of those cancers are HSA. It's why vets get concerned and often recommend being proactive with diagnostics, potentially including surgery. You just can't assume it's benign based on how it looks on ultrasound.
Right. Imaging alone isn't enough for that critical distinction.
Exactly. Understand why diagnostics like ultrasound and blood work are needed, but also why histopathology after removal is often the necessary gold standard to get the definitive answer and plan appropriately. And just be prepared for that prognosis to vary widely based on what they find.
And knowing about those breed risks we discussed earlier can also provide some context.
Definitely helps frame the possibilities.
Well, thank you. That was a fantastic walkthrough of a really complex topic. It really drives home how interconnected everything is inside a pet's body.
It truly is. The spleen is just one piece, but its health tells us so much about the whole system.
So, as a final thought for you to chew on, considering how many causes of splenomegaly are systemic infections, immune issues, even heart problems, what does the spleen's reaction really reveal about the deep interconnectedness of all our pets' internal systems, and how trouble in one spot can send ripples everywhere else?